Hopefully, can you guys hear me? Can you hear what I'm saying? Okay. All right. Hello, hello. Thank you for watching this video on the replay. This is Nurse Choma. I'm going to be going over and talking with you about why BBLs are bad for you and why you should reconsider about getting it if you're thinking about getting it. And yeah, and I hope that this is going to be impactful and powerful and will maybe change the course of your life. Or you can pass this video on to somebody that needs to hear it, that needs to be aware of this information, that may be thinking about getting a BBL. So what is a BBL? Essentially, that's the short word, but it's called a Brazilian butt lift, okay? And a lot of the reasons why many young women decide to do this procedure is because they want to get a big butt, right? They want to, and they feel like that is what is praised and that is what is recognized as being beautiful, and that makes you a woman, quote unquote, or makes you feel more like a woman. It makes you feel better about yourself, etc. And so there are people, girls as young as 18 years old getting BBL procedures. That are traveling outside of the country, traveling to other third world countries to get it done, not knowing the risk behind it truly, and not understanding the repercussions of getting the procedure done. Because what's happening is that you're getting it done because of the short-term desires. Like you're getting it done because, can you guys hear me on here? Okay. You're getting it done because of what you're thinking about right now. You're not thinking about the next 5 or 10 years as far as what it's going to actually do to your body in the long run. That's what you're not thinking about. And this is something that I want to kind of help you to better see. And the thing about it is that there are short-term risks, and then there are also long-term risks behind having this procedure done to your body, and it's something that you got to really think about. So have you actually taken the time to learn what the procedure entails, like what they actually do, what happens when somebody gets this done? So what they'll do is that they'll go into your body. All right, they'll look for areas of your body that has fat in it, and it's like essentially they're plucking the fat areas, and then they will put it in the butt area, right? Now, one complication among so many that can happen is that when they're doing it, the fat cells. It's a high risk procedure if you don't have somebody that's really knowledgeable or that is expert in doing this. And so what can happen is that the fat can travel up to the heart and can cause what we call an embolism. And so what that means is that, so there's something called the superior. Let me see if I have my heart. Okay. Oh, yes. Let me grab this one. Okay. All right. So there's something called, imagine this is the heart right here. And up here is the superior vena cava, and then you can't see it, but down here, it's not on here though, would be the inferior vena cava. So what happens is that when you decide to do a BBL procedure, they take some of your fat and they put it in the butt area. Particles of that fat can travel, if it happens, can travel into the heart. It will go through the heart and cause a embolism, and that can cause you to have difficulty breathing. If the embolism travels through your heart, it can get clogged in like an artery or something, and you can have a heart attack. Which is not as common. You can have a stroke. Of course, with the procedure, there's a lot of bleeding involved. Because they're literally cutting up your skin and closing it back up again. Right, so there's going to be a lot of bleeding involved as well when being done. There's a number of different risks. It can also become infected too. So for some people, they may not do it this way. They may put actual like silicone or some type of gel, something that's not necessarily fat cells, which is I think a different type of name for it. But that can cause an infection over time. So it can become, you can have an infection initially from the procedure, and then you can have an infection over time as well. I've seen a lot of articles of women traveling overseas to get this procedure done and dying on the table. And sometimes it wasn't even the procedure itself, as far as the cutting part, but the doctor didn't give them the correct amount of anesthesia, or there wasn't enough precautions put into place to protect the patient, to protect them from dying essentially. So what that could look like is, so essentially when you have surgery, and they put you under anesthesia, one thing they're supposed to do is get your weight. So they have to get your weight in order to determine the correct amount of anesthesia that your body is supposed to have, so that way they anesthetize you correctly. And from there, when they do the procedure, then hopefully after that, the other complications does not occur either. So this is what I'm talking about, though, is that been a large number of women, young women, going to countries like Dominican Republic, Brazil, different types of third world countries, to go and get this procedure done at a very cheap rate. And you did not really research the doctor very well. You just found out about it, and you heard somebody tell you about it, or a friend told you about it, but you're not aware of the doctor's credentials. And as a result, boom, you go over there and you don't see it coming. So a lot of these people too, they end up dying in the hospital, in that hospital overseas, because they were not properly, they didn't get the proper amount of anesthesia. Sometimes what can happen too is that when you're supposed to go for a procedure, prior to the procedure, the doctor will often put you on prophylactic antibiotics, which is where they give you antibiotics to prevent an infection. And so there's also been stories of these young women that died from an infection that way. Some of them, they went for the surgery, they didn't wake up. Sometimes they went, their heart did not revive, right? So their heart did not beat. So like there was something that occurred that caused their heart to stop working. And so that's how they died from the procedure. And then it's not also just doing the procedure itself, but then finishing the procedure, and then you wake up or you're alive after the procedure is over. But then it's also, after it's done, the long-term effects of it over time, right? If it does get infected, and then now you have to have it removed and taken out because of something that you did at a specific time in your life, because you wanted to feel good. You wanted to feel beautiful, special, recognized, etc. And you have to stop and ask yourself, why am I doing this? Like, really, like, why am I getting this done? What's my true reason? If you're doing it before a guy, please stop right there. Because if the person doesn't love you for who you are right now, I promise you, that's not going to do anything. Okay. It's really not. So this is one of the things, is that you have to stop and think about and think it through. Why am I having this done? There's so many other ways that you could have a natural, bigger behind, if that's what your goal is. There's so many other more natural ways of doing this that will not have long-term consequences. You can, for one, begin to eat more potatoes and do more certain type of exercises, squats, things like that, where you begin to exercise better. You begin to be more mindful of how much protein you're taking in. So consuming more protein in your diet, obviously less sugar and etc., less oil, less grease, but you're taking in more protein from your diet. And you're doing those, you're going to the gym and you're working it the normal way. Protein is going to be really essential, even if you're like a stick figure. Even if you're like a stick figure and you got nothing, trust me, you can work your way up. But you have to begin to just make changes to your diet and begin to consume a lot more protein, and then begin to go to the gym on a regular basis and start working out, and really work out so that way you can build your body healthy and naturally, not doing all that and now you're crying and regretting about it in the long run. And so it's definitely not worth doing, right? So this is something that you really got to think about. Is your life really at risk for a momentary thing? Something that is momentary, something that when you're a mother, right? When you're a mother, is it going to matter that much? You know, is it going to matter that much? What's going to happen? How are you going to age with that in your body, right? How is that really going to affect your body over time? And of course, the doctor is going to tell you, don't worry about it, you're fine, because they want you to get the procedure done, of course. They're never going to discourage you not to do it, right? Like that's always going to be, they're going to have a biased point of view. So you have to go to somebody that is non-biased, and then you have to ask the right types of questions. But there's so many people that's dying. There was one person, sometimes it's not even the death. Sometimes it's the additional consequences that you forever live with. One woman, Black woman, she went to have the procedure done, I think in the Dominican Republic, and she did the procedure and now she's paralyzed. She's literally limited to a wheelchair. So she's young, and now she has to live in a wheelchair for the rest of her life. These are some of the things that people don't think about when they travel overseas and they get these procedures done for super, super cheap, because they're not thinking that there's consequences to a discounted BBL. You know, like there's consequences to that. So why not do things the natural way, right? The way that will give you peace of mind at the end of the day, because you did it the right way, right? You did it the right way. You did it in a way where you can be proud of, pleasing, and then also at the same time, you're working on the rest of your body as well. So you're working on your health, you're eating better, you're making conscious decisions, you're going to the gym, you're walking, you're exercising more, like you're doing all those things. And I'll tell you right now, especially as a nurse, I've taken care of patients who have gotten these procedures done, and now they're like 40, 50, 60, and their face, their body looks strange. It looks very unconformed to the procedure. You know, if I can use the right choice of words, like it just looks so unbalanced, and their body just doesn't looks very strange. And um, some of them, there's new conditions that they're dealing with as a result of going through this procedure. You know, as a result of doing this. And so a lot of times when I'm taking care of them, I don't even have to look at their medical history. All I have to do is just look at the patient, and I know, oh yeah, this person, they had work done. They definitely had a lot of work done to their face, to their body. They had the procedure done, like you can tell by looking at them, and not in a good way necessarily. Not we're like, oh wow, yeah, they really look amazing, but more so like they had this procedure done, and it's in their body. I think there's a show. I forgot what's it called. Forgot what the show is called, but it's like a really popular show on TLC where Botched, BOTCHED, and that's how a lot of the patients look when they come into the hospital, and now they're 40, 50, 60 years old, and they don't look like they probably look like when they first got it done when they were like 17 or 20 or in their 20s. So really, really realize it's a life and death situation, and you have to think about, why am I doing this in real life? Like, what's motivating me? And many times it's not the right reasons. So I hope I hope that what I shared um, gave you something to think about. Hopefully, you'll share this with someone that may need to hear these words. Thank you so much for taking the time to watch, listen, and be on here. You're welcome to comment below and give your thoughts, feedback. And yeah, thank you so much for tuning in. If you want to check out my beauty store, okay, where I created my own online beauty boutique where I sell different products to help you to feel good and look good, you can visit my website, chomasbeautystore.com. Chomas, my name, CHIOMAS, beautystore.com, or visit the link in my bio. All right. Thank you so much for tuning in. I hope this was helpful, and I'll see you guys the next time. Bye.